Mr. Speaker, no one should go bankrupt because they get sick. I was proud to be able to invite and join Director Chopra of the CFPB, along with Congresswoman Debbie Dingell, in hosting a roundtable on the impact of medical debt on our families. We talked about the groundbreaking proposal by the Biden administration that would change lives of millions of people, where we would ban and prohibit medical debt from appearing on people's credit report. I know this step is long overdue. Having introduced legislation like the Restoring Unfairly Impaired Credit and Protecting Consumers Act would prohibit outright the reporting of medical debt on consumer reports. Today, 15 million Americans have $49 billion in medical debt on their credit reports today. In Wayne County, which is the largest county in Michigan, nearly 1 in 6 residents have medical debt. But behind these numbers are real people. There are families whose lives are being impacted by this crushing burden, all because they got sick. We heard this firsthand from one of my residents, Livonia resident Erica Price, who is devastated by our broken healthcare system while watching her husband's body deteriorate. For many, medical debt means sleepless nights worrying about making ends meet. Some families go bankrupt. Others lose their home. This is wrong. And again, no one chooses to be sick. The burden of medical debt can also haunt families by lowering their credit score, preventing them from getting a job, even be able to rent a home, even be able to get a car or small business loan. To add to this crisis, I joined Senator Bernie Sanders and Congressman Ro Khanna introducing Medical Debt Cancellation Act to eliminate medical debt completely. We know that we have sick care in our country, not health care. We know that this is also an economic and social justice issue, and that many of our low-income families are most vulnerable. Some of my seniors, even with insurance, are starting to see medical debt rise. We also know many of our Black and Latino neighbors are more likely to be impacted. We know that without Medicare for all, millions of people lack coverage while expenses continue to rise. We all deserve so much better than a broken healthcare system that profits off of sickness and leaves more than 20 million people without health insurance. No one should lose their home or have to declare bankruptcy because they got sick. Medical debt should never haunt someone financially. This body must take action to relieve this burden for many of our residents. Mr. Speaker, I'm sick and tired of DTE's Energy's corporate greed. While many residents suffer the consequences and it goes days without power in Michigan, our families can't afford more power outages that spoil their groceries, and guess what? They only get $25, sometimes $35 in reimbursement. That ruins their medicine that's in the refrigerator. They leaves our neighbors without access to critical medical devices, all because DTE would rather pay out their executives, look it up, and their shareholders than ensure reliability. They defer maintenance and rather, again, pay our shareholders instead of making sure their grid is strong and reliable. Last month, the record-breaking heat waves, temperatures reached 95 degrees in southeastern Michigan, while over 200,000 residents went without power due to DTE Energy's failure to invest in their infrastructure upgrades while continuing to raise the rates on our families. The company made $1.4 billion in profits last year alone. Their CEO, Jerry, makes $10 million a year. But they are begging the Michigan Public Service Commission to approve more rate hikes. I think it's the third or fourth already, and asking our residents to pick up the tab for their executives to travel on corporate jets. It's shameful. The Michigan Public Service Commission should reject these outrageous rate increases. They're not reasonable. They're not fair. We need utilities that serve the people, not shareholders. We need public power. DTE and other not-for-profit utilities should be turned into publicly owned and operated services. We see it over and over again by DTE's action that we cannot allow these corporations because they're always going to put profit before our people. Mr. Speaker, the Individuals and Disabilities Act, or IDEA, is often hailed as landmark civil rights law, the most important civil rights laws in our country, offering a promise of equal education for all of our children with disabilities. We continue to fall short, though, in this promise. The 50-year-old law is underfunded to this day. We passed it in the 1975. And we promised to pay 40% of the cost of the federal mandate on our school district, and we're only reaching about 14 to sometimes 17%. We're not doing enough. Paraprofessionals alone in Detroit are working without a contract right now. Our federal government promised to cover 40% of the extra cost of special education.
Gentlelady's out of time.
Thank you.
Chair now